Welcome to the webinar today from Civil Society Wash Fund. Today we're looking at CSOs engaging local government for market-based sanitation. For those of you not familiar with the Civil Society Wash Fund, it is an Australian aid initiative and supporting 13 civil society organisations or NGOs, Australian and international, working in 29 projects in 19 countries. It's a 4-year program and we're about halfway through, and today we'll be hearing presentations from Juliet, Willetts, and also some of the 2 CSOs who are part of our fund. This webinar today is part of a phased learning approach which is linked to the East Asia regional learning event of the fund, which is going to be held in Hanoi in July. Prior to the webinar today, we also ran an e-discussion, which if you weren't part of it, you may also be interested to read on our website. Apologies if my voice sounds a little funny today. I do have a cold, but we will press on anyway. So just to give you an outline, hopefully this slide clicking is going to work. So our agenda for today is that we will, obviously I'm doing an introduction now, then we will hear from Associate Professor Juliet Willetts. Juliet is from the Institute of Sustainable Futures at the University of Technology in Sydney, so is joining us from Sydney today. And she's our topic expert for our upcoming learning event, and we're looking at private sector engagement in sanitation at the local level, but with examples from across the region. So we look forward to that presentation from our topic expert. Then we also have 2 case studies. We have one from Plan Indonesia, looking at linking sanitation marketing and financial institutions, and then another one from IDE Vietnam from Quang, who is looking at scaling up sanitation marketing with government. So we thank Harry and Quang for joining us today and giving those case studies. We also have time at the end for questions and answers, and I'll explain how you can ask questions and type them into the box, and also raise your hand to ask questions as we progress. Just so you can put a face to a name, here's the team for today. So Juliet, Quang, Harry, myself and Amy Savage, who is working here with me in the background on the GoToWebinar platform, making sure it's recorded and it's all working well at this end. So just in terms of guidance and the best way to use this platform, please mute yourself. At the moment you're all muted, but we can take that off later. It is best to stay muted while listening to the presentations, because if we don't do that then we get feedback, and also it reduces feedback if you use a headset. If you wish to speak, you can raise your hand. There's a hand icon that you'll be able to see in the attendees pop-out bar. In terms of questions, there's also a question table, which some of you are already using. Any of those little boxes, if you press the little plus sign, it will expand and you can see a whole table there where you can write questions. You will not be able to see the questions of others, and you will also not be able to see the other participant names in this platform. If you do have any difficulties while we're going through the webinar, you can send an email to CS Wash Fund online, and Amy's monitoring that and be able to respond. But also there is a lot of good technical support for this platform GoToMeeting online, so that's the link there should you need it. Just to explain exactly what this looks like for if you haven't used this platform before, the hand icon is there, so in that attendees box you can raise your hand if you actually want to speak. David, I can see your hand is raised. I'm not sure if you actually want to speak at this point or not. No, hand's gone down. There we go. So that's obviously working. Excellent. And then the question box is also where you can type in the questions. We ask that you don't use the chat box for questions, because then it is hard for us to see that. The questions that are going on into the question box at the moment, all of the presenters will be able to see that, and that certainly helps all of us. So that's much better if you could please type the questions into the question box and not into the chat box. So I think that's it as far as instructions. So thanks for listening, and now I will we'll change presenter and hand over to Juliet, who will give the first presentation. So here we go.
Okay, good morning, afternoon, good evening, depending on where you are. This is Juliet Willetts speaking. Great if one or two people could write into the chat box to confirm that you can hear me okay. Yep, okay, fantastic, thank you. So this webinar presentation is focused on working with local government to facilitate market-based approaches. And I'll be drawing on research through the Enterprise and WASH work that we've been doing over the last years and a couple other examples from elsewhere. So first of all, the obvious question is, why not just work with the private sector? Why is it important to think about working with local government too? Certainly to date, a lot of emphasis has been on the different approaches, particularly for CSOs, civil society organisations, on how to engage with private sector. But there are many reasons why government, and particularly local government, are a key consideration too. So firstly, in the context of the human right to sanitation, governments are the duty bearer, responsible to facilitate equal access to everyone. A second reason is that governments obviously set the policy context, and this can either make it easy or quite difficult for enterprises to play roles to support providing sanitation products and services. So thirdly, if we're thinking about working at scale and beyond just individual locations or individual enterprises, we need to think about how to expand focus, and obviously that requires working with those organisations with the mandate and working at larger scale. A fourth reason, especially thinking about civil society roles, is what happens after you leave? Who's going to play any market facilitation role that you might have been playing? And local government are a possible actor for that. And lastly, just in terms of good aid practice, is about aligning approaches to partner government strategies and institutions. But then there's a second question. Why should local governments care? Why would they even be interested in looking at supporting private sector and enterprises in sanitation? What would their interest be, and what incentives could help? And so I guess through our research we've seen a few different reasons why governments and local governments have chosen to get involved. Firstly, when their coverage targets are when pressure is being applied to achieve those, they can become interested in different ways of achieving them, and that might include working with enterprises. Another is that they may be being rewarded for promoting progress and for innovative approaches. A third reason, and this one's fairly controversial, is that in some contexts they may play roles themselves directly as sales agents, and they may be receiving some benefits, or even in some contexts they may be running their own enterprises in tandem with a local government role. And finally, sometimes it's core business. So often when we're talking about local government involvement in sanitation, we're talking about the line agency that's responsible for sanitation, which is usually health, though it can be other agencies. However, at local level, often there are agencies responsible for the development of the private sector in that locality, and that's their core business, to support enterprises. And so they may well have an interest, since it's their daily job. And then thinking about local government, the thing is that tensions arise and a pull in different directions between perhaps supporting the private sector in different ways, but also obviously local governments need to provide oversight, monitoring other functions, and that might pull them in a different direction. And so I guess our experience in working across many countries in Southeast Asia is that there's a lot of local government officials feel quite confused about what their role could or should be. So then moving on to thinking about different levels of government, that at the national level where you're setting the broader enabling environment, I guess the key question is about, does the policy give recognition to private sector roles? Is there a broader enabling environment that promotes the role of private sector? So for instance in Vietnam that is the case. It's been more focused on the water sector, but more broadly there's the inclusion of a focus on where and how private sector can play roles. And then at local government, the key question in terms of roles they might play, which would be to facilitate market development, to regulate enterprises and to ensure equality of outcomes, then we have questions of what kinds of skills, interests or capacity there is at that level. So these are key questions civil society organisations might need to ask themselves when thinking about working closely with government in relation to market-based approaches. So just to unpack each of those three roles, what do they look like? So local governments can play roles in market facilitation, and that might be any of these points you see, linking demand and supply, providing training opportunities, supporting associations of entrepreneurs, providing market assessment information, and that list is not comprehensive. There are many more possible market facilitation roles. A second set of roles that relate to oversight or regulation, that's then thinking about, well, who's going to make sure that things are built to a certain quality? Who's going to protect the consumer in terms of they're paying money to a private sector actor for a particular product or service, and can we be sure that that product or service is of quality? And also in terms of business licenses and registration. And then the third area, ensuring equality. So this comes back to the human rights and the question of monitoring who gains and who loses through approaches that support private sector roles, and identifying who requires support and what mechanisms might be possible to support them without undermining market roles more broadly. And then the broader question, what can a civil society organisation do? So through our research we've observed quite a lot of different roles that civil society organisations have been playing between the interface of government and social or private enterprises, and that includes brokering relationships, bringing people together to find out how they can work better together across the private and public sectors, advocating for government support or incentives for enterprise development, and I think you'll hear from Harry a plans example of that type of work, assisting in securing funds to support professional associations, influencing the broader government and policy and regulatory environment, and the last point, which I think is actually often, less talked about, but there can be a real mistrust around private sector and private sector roles, both amongst community and amongst public sector actors. So what we've also seen is CSOs just building trust between different actors on how each actor can play roles. So going in now to each of these three areas of facilitation, regulation and ensuring quality, a few more detailed examples. So firstly, this question of funding, and that local governments may feel a bit conflicted and unclear or unsure about roles to play, and this we've noticed particularly true in many countries around health agencies, that they feel very comfortable funding different types of demand creation approaches and community facilitation of that type. But when it comes to thinking about spending money to support the private sector, that can sometimes be rejected, and there can be an expectation that, well, the private sector should just be able to sort itself out. That's not our role to initiate or help them. And even in some places, so in Vietnam, in some provinces, we found local government reporting that they actually weren't allowed to spend money on, for instance, on training masons, that was not appropriate use of funds. And in Indonesia, some local governments saying, well, we'd love to support enterprises, but we really need to do that via an intermediary, by some form of not-for-profit organisation, because it would be inappropriate for us to be seen to be directly supporting private sector. And so I guess one of the roles for civil society organisations is about clarifying this whole situation and building up understanding about what are and aren't appropriate roles for local government to play. And then a really important role that local government are able to play is about this link between demand and supply, and from thinking about how do we promote different enterprise products or services to households. So we know that that link can be very difficult. It's difficult in terms of having enough enterprises working at the correct scale that we need for, to match demand creation activities, and in terms of the timing, and making sure that communities are exposed to what possible products or services could be available to them. But this role, if local government are playing a role in that promoter position, can be quite complex. So this question as to whether or not, if they're playing roles, should that role be paid? If it's not paid, then are there enough incentives for them to actually be active in making the link between households and enterprises? And certainly in Vietnam we found situations where village health workers or commune governments they didn't feel that there were incentives, there weren't reasons for them to make the links. And in some circumstances civil society organisations have tried to provide incentives, whether financial or other types of incentives, to help make it meaningful and there to be an interest for those local governments to play a promoter role. And I guess the complexity can be, even further in terms of public and private roles. So in East Timor we found that since there was a history of subsidies and a history of communities expecting government to just provide hardware directly, local government was saying, well, we really can't start playing roles to support enterprises because it will just be perceived that that there's a lot of corruption going on, that probably the community will assume we're being paid, and that the private company is demanding community members to pay, and that both private and public actors are making money out of this. So they were saying it was really difficult for them to play some kind of role. So I guess amongst all of this, civil society organisations need to make choices about where and how to support local government and how to think about those incentives for them to play roles. And then moving on to how local government might monitor or regulate enterprises. This is an area I think that's probably more just emerging in terms of practice to date. It's obviously really important. We've got public health outcomes, we've got environmental outcomes that we need to reach through sanitation, and we don't want to lose sight of those no matter what method we take to improving access to sanitation. And so some examples we've seen have been CSOs working with government to help certify masons, and so these are masons who are seen as being able and qualified to build toilets to a certain standard. It's also been an area where it can become quite complex, and we need to be careful that we don't have over-regulation, if you like, of the sector and setting up of perhaps, say, design standards that are overly stringent or and might make it too difficult for enterprises to function. So there's a very fine balance here about the support and regulate functions. And I guess another area in terms of monitoring is simply local government to be understanding, is enterprise development and roles in the supply chain working in their area? What are the results? What else needs to be done to improve an approach? And so that doesn't necessarily need to be a CSO doing that. It could be a CSO facilitating a government to play that role. So moving lastly to this area of ensuring equality. The graph that's in front of you is, I guess, showing visually how the cost of, in this case, a squat toilet pan in Vietnam, in Dien Bien in the far northwest, how it can increase as you go from a district town all the way up to a village, and how adding on the transport costs and the different actors in the supply chain can really increase costs. So we need to be very conscious of this phenomenon. We need to be conscious of affordability and the situation of particular disadvantaged people or people living with a disability, and local government has a role to make sure that everyone is receiving access. And some of the examples and the complexity, I guess, we've seen to date is the need for policies and strategies that help align how different people are defining who should receive extra support. So if we are going to provide any discounts, any forms of subsidies, one of the important roles for government is obviously to decide and have clarity about those. And I think that's an area in Cambodia which has become quite complex, with different CSOs having different mechanisms and decisions about who should be provided support. And my understanding at the moment is government is now stepping in to try and normalise that and have an approach that CSOs can all align to. What we also saw in Vietnam was access to finance through the Vietnam Bank for Social Policy, which is intended for the poor. We saw, in fact, that the poor weren't necessarily being reached through that mechanism. So again, it's another place of intervention for CSOs to be working with local government to ensure that the right people are being supported and that we're reaching that goal of equality. So just before I finish, the last two slides are just to shift our attention beyond roles that are just about new toilets, which is what we tend to focus on. This graph in Vietnam of rural latrine coverage reminds us that there's increasing numbers of improved latrines, and we need to start thinking about emptying, and that's a key role that private sector play often in urban areas, but now also important for rural. And there are a similar set of functions for local government to play, which are facilitating, regulating and ensuring equality in terms of the outcomes. So I won't go into the details of those. As I say, they're similar functions, but require the same idea of working in partnership with private sector to reach outcomes for all. So finally, the take-home messages. My first one is definitely that I believe that working with government is critical, including when you're working through a market-based approach. It shouldn't be something that's ignored. Secondly, that civil society organisations need to consider the relative needs and what the current status is of local government understanding, capacity and skills in relation to market-based approaches, and think about those three roles in facilitation, regulation and ensuring quality. And lastly, not to forget sanitation services beyond new toilets, and to think about how might you work also with private sector and local government in relation to sanitation, fecal sludge emptying services. So thank you. That completes my presentation, and I will hand back to Bronwyn.
Thank you very much, Juliet. That was excellent and a good insight across a range of issues. And I think particularly we will focus a bit more now with Heri Ferdian in Plan Indonesia on the, sorry, let me just do this. I'm transferring it across to Heri. Around the financing and the financing institutions. I do note that someone has their hand up. It's probably to ask a question. Can I ask that you please type the question at this point into the question box, and we'll take all the questions at the end of all the presentations. Okay, thank you very much, and it's over to you, Heri. We may be experiencing a few delays with internet from Indonesia, so bear with us. Harry's just getting organised. Thanks, Harry. Hi Harry, if you're there, we can see your screen but we can't hear any audio. Could you please, if you're ready to present, start with your audio as well? Apologise everybody, we did test all of the sound and everything earlier and it was working absolutely fine, so I'm not sure exactly what's happened here, but we might just move on to Kwang's presentation and be in touch with Harry separately and come back to his presentation. So we'll just transfer over to Kwang. If you're ready, Kwang, I'm just going to make you presenter so you can have your presentation ready to go and turn your sound on. Thank you. Oh, hang on. Is that Harry? No, okay. Kwang, I'm going to make you presenter now. Thank you.
Okay. Hello everyone. My name is Quang. I'm from IDE, Vietnam. Thank you very much, Professor Willetts, on your presentation, because I could build a little bit on your presentation that highlight the roles of the government and CSO. So what I'm going to present is to walk you through the experience of IDE in Vietnam in working with the government to scale up sanitation marketing, and the experience that we have in Vietnam may or may not be applicable in other contexts, because the context of the government in Vietnam is somewhat unique, and with the involvement of the government in the sector. So first of all, I'd like to introduce IDE Vietnam with sanitation marketing. IDE Vietnam started sanitation marketing pilot in 2003, and we're still implementing sanitation marketing right now. At this stage, the two projects at the end of the graph colored in orange are those currently ongoing. So IDE Vietnam is considered pioneering Sanmark sanitation marketing in 2003, and all the work that we implemented in terms of sanitation marketing has been done through the government exclusively. That's not what we wished, but that's what IDE or any NGO in Vietnam has to work with and through the government as a requirement. So why we have to work with the government as the legal requirement, but there are many other reasons that sanitation marketing should be scaled up through the government. In the last project, we adopted a theory of change, a new theory of change, which is kind of highlighted to the larger extent how we need to work with the government. We view government as change agents, and IDE Vietnam has to work with the change agents rather than directly with the household. The change agents, well, government in this case, will be the one that will work with, interact with the households to support the wash services to be provided to the household. In this project, we work in 2 provinces, 5 districts, 142 communes, with 314 government change agents. They are from the health department and also from the women union. Women unions consider quasi-NGO, but their members are paid, salary are paid by the government, and it's influenced by the government. So IDE's role in this case is to provide training to the government staff on SANMARC. And after the government acquire the training, they will be able to implement SANMARC. And at the end, the sanitation market will be developed by the change agent. So I hope that most of you already are aware of what SANMARC is basically the approach that focusing on stimulating the demand, creating demand, at the same time stimulating and supporting the private sector supply chain of latrines. So this is the graph illustrates how IDE in Vietnam work with the government in sanitation marketing. So what's the role of the government here? They create demand and support the supply. So what IDE's role, primary roles of IDE is provide training. Sanitation marketing is not native to the government way of working. The government is used to community development approaches rather than market-based approaches in Vietnam. So they need change. So IDE provide training in order to initiate that change. What's the change? I would highlight 2 changes, critical changes at the government through this training to make sanitation marketing work through the government. I forgot. I should highlight a little bit more about why to work with the government. Sorry. The sanitation is considered also a public good, not only private good. So the government has a role there, as highlighted by Professor Willetts. The government in Vietnam has very strong involvement in WASH. They have national target program. They led implementation, and they involved in a regulation of sanitation design. In rural Vietnam, households tend to trust the government over the private sector, especially in the north. And in the case of Vietnam, sanitation, rural sanitation has no clear supply chain. There is no one in the private sector that would be benefiting in driving the supply chain and benefiting into investing into the sanitation marketing. It's just the service of mason paid by daily work, providing masonry construction service to households using basic construction materials as bricks and mortar and other things. So the government should have a role here to develop the market rather than the private sector itself. And if the government does mason training, facilitating the supply chain, it creates the confidence for the household in the countryside about the latrine models that the private sector will be providing, as mentioned by Professor Willett earlier. So coming back to what the role of the government in demand creation and supply chain support. The first change, the most critical change that IDE saw that needs to be happening at the government capacity is the promotion. The government traditional promotion is very much top-down as information, education, communication campaign. So there is no user insight in the design and promotion. Government officials tend to think that they know everything, they design everything, and without getting the insight of why the user, the household, need a latrine for. So they're often mistaken about the reasons why people want a latrine. And IDE that suggests the promotion need to be user-centered, need to be household-centered. Through the research of IDE, we suggest that promotion should forget about hygiene and sanitation, because rural households do not care about hygiene and sanitation when they make a decision about purchasing a latrine. They care about other benefits, the convenience, the status. So that are the main and the actual drivers for a latrine purchase. So IDE suggests that the government should change, stop talking about hygiene, focusing on other benefits that the household would care about. That's the major change. And the change that we trying to achieve and we have to achieve is the mindset. And then what we did is to design, demonstrate how the new change, forgetting about hygiene and sanitation, focusing on the benefits, actually results in the demand creation. Then we go and train the government staff after we demonstrate the impact of the change. So this is what we do in demand creation with the government. At the result, after such process, the government staff believe, after observing the new design, they believe, and they started to conduct promotion in a new way, forgetting about hygiene. This is a photo of government staff conducting group selling using a user-center approach. In terms of supply, another critical change here is also the mindset. The government often looks down on small rural masons, and there's no support provided to them. And IDE suggests that the government should work with the private sector mason here for two reasons. First, the latrine in countryside in Vietnam often cost very high because small masons do not have technical knowledge about appropriate latrine design for a lower cost. Like, so we, and secondly, the the government doesn't see that the mason actually have them achieve the target. So the change is we help the government to conduct simple technical training on approved low-cost latrine design and to encourage masons to collaborate. When leaders at the government did that, lower level officials will follow, and then they would be encouraged to work with the private sector. So this is how the the government start conducting mason training, and private masons are invited to talk during group selling organized by the government, which is very unusual before the SANMARC. Thank you. This is kind of a two major changes in the demand and supply chain that IDE help to change the government to make to have the sanitation marketing actually implemented by the government.
Thank you very much, Quang. That's great to hear so much about how IDE is actually operating in Vietnam, particularly with the sanitation marketing and how you're interacting with government. We will go back to Harry now and check that we have the technology working and that he can present. So I'll change presenters over.
Hello, hello.
We hope for the best.
Hello.
Hi, Harry. We can
Hello?
hear you now.
Yeah. Can you hear me now?
Yes. Your screen's just
Okay, great. Okay, my presentation is
it's still
is
in process, but it should be
is
happening
it showed?
in a second now. Not quite yet. It's in process.
Okay. Okay, I have shown my presentation on the slide. Can you see it?
Yes, we can see it now. Thank you.
Okay, I will start the presentation then.
Great. Go ahead.
Okay. Good day, everyone. Thank you, Bronwyn, for facilitating this webinar. My name is Harry Ferdian. I work for Plan Indonesia as water specialist. At this webinar, I would like to present the sanitation marketing topic, particularly on engaging local government in sanitation marketing activities, and also we'll talk about the cooperation that finance the sanitation marketing activities in Indonesia. This presentation is summarized from our learning and experience in sanitation marketing activities in entity province that have been conducted by Plan Indonesia and Plan Australia, with support from Australian Aid through CSOs Fund 2 for the past 3 years. As some of you may know, that Indonesia has the second highest number of people practicing open defecation, with approximately 50 million people who still practice open defecation. Government Indonesia calculate that Indonesia needs at least 294 trillion rupiah, or equal to 20 million US dollar, to solve this problem. This is very difficult for national government of Indonesia, since they can only provide 5% of the total budget to solve the problem. Luckily, government of Indonesia through Ministry of Health at the present has issued the national policy of sanitation and hygiene with behavior change approach. The policy is called STBM. STBM stands for Sanitasi Total Berbasis Masyarakat, or Community-Based Total Sanitation. It is WAS's national policy using the CLTS approach. STBM, as you can see on the slide, has 5 pillars. The first pillar is stop open defecation, hand washing with soap, safe drinking water and food handling, solid waste management, and liquid waste management. Our project area is in 5 districts in Entity province, as you can see on the slide. Entity is the second lowest sanitation access of any province in Indonesia. There is only 28% people who access improved sanitation. The other problem is entity has low availability of low-cost sanitation product. Also, sanitation entrepreneur who provide sanitation product is still limited. Based on the problem described, plan decided to conduct the sanitation marketing activities and engaging it with local government to ensure scale up and sustainability of low-cost sanitation and hygiene that could contribute to increase STBM access. In order to sanitation marketing activity, Plan Indonesia conducts several steps to ensure sanitation marketing activities are established and engaged with local government. These steps are first is obtain government commitment upfront. This include support for sanitation marketing. The government commitment could be gained at the beginning of the project and stated in district roadmap or interest letter. Plan conduct several workshops in provincial and district level to gain government commitment. And the second step is establish and piloting sanitation marketing activity in 15 pilot sub-districts. At the first and the second year of the project, plan conduct sanitation marketing activity in 15 pilot sub-district and expect government to replicate it in the next 3 and 4 years with government fund. This phase is called capacity building phase, both for sanitation entrepreneur and also for government. And the third strategy or third step is use cooperation, or you know it as cooperation. Cooperation is Indonesia's funding mechanism that organized by a group of micro business actors. They collect money and invest it to conduct business together and share profits among them. This funding mechanism is aimed to expand sanitation business and so they can achieve larger group of customers. And the fourth step is conduct budget advocacy to government budget to fund sanitation marketing as part of scale up and sustainability. This step is aimed to ensure government continue and take over on sanitation marketing, monitoring, and also scale it up in other sub-districts outside the pilot area. The budget advocacy is conducted in district level at the district development planning meeting, or in Indonesia we call it musrembang. This is the, as you can see on the slide, this is the model of sanitation marketing strategy in Indonesia. We have different roles between Plan Indonesia as CSO and the government, and also the sanitation marketing entrepreneur itself. As CSO, Plan Indonesia's role is to ensure that government and sanitation marketing entrepreneur doing their role and facilitated them as partner in order to support STBM program and ensure the sustainability and ensure that low-cost sanitation and hygiene product is sustained. So we facilitating them to be a partner, government on the other side as a leader to conduct the STBM program, and the other side, sanitation marketing, is to support STBM program itself by providing supply of low-cost sanitation. After years of implementation, we have achieved some significant change in STBM program after intervention, particularly related to sanitation marketing activities. As you can see on the slide, the number of established sanitation entrepreneurs, established sanitation marketing association, number of people access low-cost sanitation and hygiene product has increased significantly. As you can see on the slide, before intervention, the number of, for example, active sanitation entrepreneur. Before intervention only there is no sanitation entrepreneur at all, but after intervention increased to 27 sanitation marketing entrepreneur. And also the government budget in 5 districts for STBM and sanitation marketing has also increased in the year 3 or 4 of the project. This achievement show that the successful theory of change and program design. In this slide, you can also see the number of sanitation and hygiene products in detail that successfully sold and distributed to community. It is approximately 5,000 products, more than 5,000 products that have been sold and delivered to community, sold by sanitation entrepreneur. This slide show that many products that have been successfully developed and sold by sanitation entrepreneur. This product is not limited to support pillar 1 of STBM, the sanitation pillar, but also to support other pillar of STBM like hand washing with soap, safe drinking water, solid waste management, and liquid waste management. So there are many products that have been developed and sold by sanitation and sanitation entrepreneur in Indonesia, because we have because STBM have 5 pillars, so the product is also have to support those 5 pillars. Besides the successful of sanitation marketing implementation, there are still challenges that we are facing. The challenge are government's role in scaling up Sunmark support while its planned role reduced. Plan Indonesia STBM project will be phasing out after year 4. We need to ensure that partnership between government and sanitation entrepreneur is sustained. And the second is production cost is much higher in several remote areas. Engaging financial institution is needed to solve the challenge. However, approving sanitation loan is the other challenge that we are facing. And the third challenge is challenge with bank to approve sanitation loan for low-income consumers. This is still related to the previous challenge. We need other learning from other CSOs about what is the strategy to engage financial institution like bank, so they will finance the loan for sanitation. Maybe if there's participant from other CSO that will share about this, it will be very helpful to solve the challenge in Indonesia. And the third and the last challenge is involving more people with disabilities in sanitation marketing activity. So far, the participant of people with disabilities in Sunmark only limited in-house level when sanitation entrepreneur construct toilet together with the people with disability as the customer. But there are still few of people with disabilities who involved in Sunmark business. And the last slide is the learning that we gained from the work that we have done in Sunmark for the past 3 years. The learnings are obtaining upfront government commitment to enable government support for sanitation marketing. This is to ensure that government commit to support sanitation marketing at the beginning from the project. Once they give commitment, they will support the activity and also will fund the activity, particularly in sanitation marketing. And the second learning is people with disabilities need to be involved in sanitation, ensure people with disabilities to ensure that the sanitation and hygiene facilities is accessible for them. And the last is identify which government agencies that will contribute to the sanitation marketing activities itself. District Watch Working Group is the government ad hoc organization who lead the STBM in Indonesia. They came from many government agencies. We need to identify which government agency who could support Sanmark and fit with their jobs description and their function. For example, District Health Agency's role will be linking Sanmark activities with health promotion program in village level, while District Microfinance and Cooperasi Agency will conduct the other role, like organizational capacity for sanitation entrepreneur group. Okay, thank you. This is the last slide of our presentation. Thank you. Back to you, Bronwyn.
Great, thanks so much, Harry. That's fantastic. So we are, I think as I put in the chat box, we are running a little bit behind time, but we will continue with a question session. So I think we don't yet have that many questions appearing in this chat, in the question box. Hopefully we'll start adding some questions in there. Oh, here we do. We have a first question. So this is from Mohammed. Mohammed, would you like to ask that question out loud? If you unmute yourself, you would be able to ask that question directly to Harry.
Yes.
Yep,
Hi, hello.
Hello, Ferry. I have a question about the big challenges to promote the sanitation product to the consumers.
Yeah.
I mean that how to explain to the consumer that this is the good product and the low price, and how the price is affordable for them. And then secondly, I would like to ask about is it possible for the scheme to the consumers to buy the
Hello?
product by loans and
Sorry, I think we lost him. Hello?
Sorry, I just forgot I was muted. The question that Mohammed was asking was about the affordability of the sanitation products, how you communicate that to people, and also if there are loans that are available via installments.
Hello, this is okay. This is question for me, yeah?
Yeah.
Yeah. Okay. For the promotion, we have a promotional strategy that explain to the community that we have conduct several promotion events, like in the village meeting event or any other village event meeting. So we explain that we explain the details of the product to the community, so they will choose which one of the product that they afford to buy. We have so many choices that community can choose. In Indonesia itself, we have many choices of the package toilet package. So the community will choose which package that they can afford to buy. That's the first question. And the second question is the loan. Yeah. This is the challenge that we are still facing about the loan for sanitation. In entity context, there are still no banks that can finance the sanitation loan for community. But I think the challenge now is how to convince the banks or other microfinance institutions, how to convince them that the sanitation marketing is profitable, so they can approve the loan for sanitation. That's the question. That's the answer for the question number 2, Bronwyn.
Thank you, Harry. There are quite a number here that are about a number of questions that are popping up around the building government capacity and the role of government. So there's a specific one here, I think it's to you, Kwang, about your approach to working with government, saying that IDEs doing the designs, and do you have any approaches where you're building the capacity of government so that they can do the designs in the long term for sustainability?
Yeah. The design could be replicated easily after their mindset is changed. And secondly, in the future, the government can outsource such design easily to local services when they understand the need for the design. Here the design based on the need review from the user is very for the government, when they have the mindset to find out why user actually want a latrine, they will design the communication based on that benefit, ignoring other benefits that they perceive as doctors, as communicator, top-down communicator in their own system. So we demonstrate by showing. We walk slowly, showing what we are doing and for them to observe. So because there is the graphic design, even IDE also outsource graphical design and other media design to external private sector, but the government also know how to do that. We don't need to do the designing in terms of material by ourselves. So the whole process is shown and demonstrated to the government, and the government will have the full capacity in designing those stuff in their own program. They design different materials themselves on outsourcing the printing and graphic design already. So there is actually no know-how here except for the change of the mindset, which is the most critical.
Thank you.
Regarding training we do for the sustainability, we do TOT, training of trainer at the district and the provincial level, so that the government at those level could retrain the commune level in the future, in expanding to other communes or districts.
Thank you, Kwang. I hope that answers your question. That was from Alois in Zimbabwe. Hopefully that answered your question, Alois. There was another question here that's from John Kelleher. It says, for both Indonesia and Vietnam, what is the key thing that motivates government staff to be involved in sanitation marketing? We heard from Juliet at the beginning that there are a range of motivations identified through the research, including the targets, the status, material interest and the fact that it's their core business. But I guess the question from John is, in the particular case studies we've heard, what are you finding are, maybe you could tell us one or two key motivators for staff, and if you could keep it brief, would come to you first, Harry. We have quite a lot of questions, which is great, shows a lot of interest, but we will struggle to get through them all in 15 minutes.
Okay.
But maybe, Harry, if you could just identify two things that you find are most motivating for government staff, and then we'll come over to you, Kwang.
Yeah, okay. The question from John is about what is the motivational factor that government involved the sanitation marketing activities. I think it's one is that from Indonesia context, that like I've explained in the first slide, that government has to the sanitation problem needs so many budget allocated with government, and which is not possible that government will provide all of the sanitation needs. Government needs other partners to do the other partners, and also need community also to buy the sanitation product. So I think this is a best solution for government, that when the government has limited budget for sanitation problem, and sanitation marketing help to promote the sanitation that will be bought by community itself. So government will save some money to not too much money to allocate for sanitation problem, because community also contribute to the sanitation problem solving. And the other key factors is that sanitation marketing is part of the SDBM policy. So this is also that can convince government that when they do the sanitation marketing, they also contribute to the SDBM national policy. So this is about the compliance to the national policy about the SDBM program. I think back to you, Bronwyn. That's my answer.
Thank you, and maybe Kwang, you could answer that question now, and then we'll go to Juliet to see if she has a response to. There's a couple of questions there as well on a similar theme about motivations.
Okay, that's a very good question. In sanitation marketing, the motivation of salespeople, financial motivation of salespeople are critical to drive performance. In the case of salespeople are government officials, and in the case of Vietnam, where sanitation supply chain is very marginal in terms of profit, so there is no such commission could be derived from the sales of latrine that could be paid to sellers or sales agent. As we observe in through different projects of sanitation marketing project we implemented, these motivation varies. And most of the time, the motivation came from the political endorsement and encouragement and demand from the higher level leadership, because they have plans, they have targets assigned by central government down to the provincial and district, allocated to by areas and to different staff. To the district and the commune. So they have mandate. They try in the past to achieve with limited budget without success, and with sanitation market, with a different approach of communication and private sector support, they could see it's doable and it's success. So that kind of encouragement from the results in combination with the pressure from the higher leadership. It's more kind of a political motivation combined with the motivation that the efforts actually yield in results. In addition, very important for the project, because of there is no financial compensation from the private sector, the project provide incentive based on performance to encourage those who could perform better, and in contrast with those who can't do the job. And with that incentive, government officials could perform, and then as they go along, they gain skill and experience through their work in sanitation marketing, the knowledge, the skill retained, and they could perform further under the pressure of the political mandate. So we are also exploring right now a mechanism for the private sector, the larger private sector, like ring producer, a group of manufacturer employing masons for providing services, to provide commissions to the government official, but mainly to the women union member who might be more willing to accept such small incentive. We are still trying. We don't have result yet.
Thanks for that, Kwang. We have, yeah, I'm afraid we will, I think there are lots of really interesting questions. We actually, we do want to wrap up webinars. It's running a bit over time, but I think we'll go to Juliet now. There's a number of questions that have come up, and you might be able to synthesize some of the responses we've heard from the case studies with your research, particularly on the motivators for government, and then we might finish with that. So over to you, Juliet.
Okay, thanks Bronwyn, and thanks everyone. Thanks Kwang and Harry for fantastic grounded presentations. So I guess just a couple points on the question about the motivations. I mentioned targets, and I think it's important to think about where we are in time in terms of the MDGs and the SDGs, because we've a lot of targets have been set around in terms of open defecation free communities. That may not necessarily be a target that then promotes local government to care so much about supply chains and more durable hygienic latrines that will last a long time. But I wonder, as we move into this next phase of the Sustainable Development Goals, targets that do go beyond ODF may also help be instrumental in terms of local government caring about how householders upgrade latrines. And then just a quick point on the kind of financial incentives to local government. Yeah, I think that's a really complicated area, and I know there's many different views about that amongst CSOs and amongst different actors in the sector. But I think there's key questions around scalability. If government are to receive some kind of financial reward for playing roles in supporting private sector, and there's also obviously opportunity for quite perverse incentives for toilets, say if it's on the basis of toilets, for them to be counting more toilets than maybe have been built through different mechanisms. I'll just briefly answer two other questions without going into any detail. So Susanna Smets mentioned which out of the three roles of facilitation, regulation and ensuring quality are most challenging for government to take on. I think there's no easy answer to that. I think they each have their own challenges. I think where we are in time is very much around understanding what the role in facilitation is. But I would say, we really need to be thinking about the other two roles at the same time, and the fact that local government's role isn't and shouldn't just be around facilitation, and particularly that question of ensuring equality, to be working on that and thinking about that role at the same time as what a facilitation role looks like is really, really critical. And lastly, a question from Georgia around poverty targeting. How do we understand who's poor? Really challenging question, and that in some countries we have government standards for those, and that it can be difficult for CSOs to question those if they're not correct. But I think there are ways that CSOs can play roles to expose where those standards may not be appropriate. But we need to balance that with, if we're thinking about smart subsidies and being very clear about who needs a subsidy and who doesn't, we may have to have quite an imperfect but well understood measure of poverty in order to be very clear about who's going to receive benefit or not, because otherwise the problems of distorting the market and potentially subsidizing where we don't need to become questions that are new challenges to be addressed. So I'd just like to say thank you, everyone, and I hope that the webinar has been useful. And back to you, Bronwyn.
Great, yes, just reiterate that. Thank you particularly to our presenters, but also to our audience. We've had some really great commentary and questions, and unfortunately we don't have time to answer those all in the time we have available, but we will ask our presenters to respond to those questions and provide those answers on our website. So we have all of your email addresses now, and we'll let you know when that's available on our website and when our presenters have had a chance to respond to the questions. So yep, thank you. I've put in some links in the chat box there, so you can, if you're not already following us on social media, you can do so, and also sign up for the Civil Society Fund newsletter. We also putting up a link to our previous e-discussion there, so you can follow that. And yeah, just thanks again to our presenters. It's an interesting conversation, and I look forward to taking it further at the Regional Learning event in Hanoi. And for those who are unable to join us in Hanoi, there will be a lot happening on our website and social media which will be representing the conversation that we'll be taking further in Hanoi. So please do stay connected. Thank you very much.
Yeah, thank you, Bronwyn.
Thank you.
Thanks, everyone.